Good afternoon, everyone.
Good afternoon.
Before starting this session, this webinar, I will like to mention one thing that if anyone have any query or any question in this webinar, we are not having any interactive session, so you can send your query or your question to our official email address harpofficial21@gmail.com, or the persons who are watching us in the FB live, you can mention your query in the comment box. We will try our best to answer you later. And the second point is everyone present in this Google Meet, please mute your microphone and please turn off your video camera except the speaker. It's my humble request to all. On behalf of Homoeopathic Education and Research Foundation, I, Rishita Ghosh, welcome all of you present here, and I want to say thanks from the bottom of my heart for being present here. Today, we have gathered here to celebrate the 266th birthday of the founder of homeopathy, our master, Dr. Christian Frederick Samuel Hahnemann.
Before going to the main part of the webinar, I would like to request Rishita Ghosh to inaugurate this beautiful event today with a song. Welcome, Rishita.
Thank you, Diptangshu. প্রাণ ভরে তৃষা হরিয়ে মোরে আরো 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 দাও প্রাণ তব ভুবনে তব ভবনে মোরে আরো 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 দাও স্থান মোরে আরো 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 দাও প্রাণ প্রাণ ভরে তৃষা হরিয়ে মোরে আরো 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 দাও প্রাণ। আরো আলো আরো আলো এই নয়নে প্রভু ঢালো আরো আলো আরো আলো এই নয়নে প্রভু ঢালো সুরে সুরে বাঁশি পুরে মোরে আরো 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 দাও তান মোরে আরো 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 দাও প্রাণ প্রাণ ভরে তৃষা হরিয়ে মোরে আরো 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 দাও প্রাণ। আরো বেদনা প্রভু দাও মোরে আরো চেতনা দ্বার ছোটাই বাধা টুটাই মোরে করো ত্রাণ মোরে করো ত্রাণ। আরো প্রেমে মোর আমি ডুবে যাক নেমে আরো প্রেমে মোর আমি ডুবে যাক নেমে সুধা ধারা দুয়ারে আপনারে তুমি আরো 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 করো দান মোরে আরো 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 দাও প্রাণ প্রাণ ভরে তৃষা ভরিয়ে মোরে আরো 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 দাও প্রাণ প্রাণ ভরে তৃষা ভরিয়ে মোরে আরো 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 দাও প্রাণ তব ভুবনে তব ভবনে মোরে আরো 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 দাও স্থান মোরে আরো 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 দাও প্রাণ প্রাণ ভরে তৃষা ভরিয়ে মোরে আরো 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 দাও প্রাণ। Thank you.
Thank you, Rishita, for taking us to the fountain of melody. Now I would like to request Dr. Milan Sengupta, President of HARP, Homeopathic Education and Research Foundation, to say something about our foundation and this seminar. Welcome.
Good
sir.
afternoon. Good afternoon, everyone. Thanks all of you for being present here. Today we are going to start the journey of Homeopathic Education and Research Foundation through a webinar on the occasion of 266th Hahnemann birthday celebration. This association has formed for the betterment of the homeopathy. Our main goals are to promote, to proliferate, and to propagate the classical homeopathy and research. We'll try to improve the homeopathic system through the various programs like that of the academic discussions on clinical practice, as well as case presentation, as well as discussion on various research topic. I think our students, our doctors, our researchers, all will be benefited from this type of program. I wish to get everyone's cooperation in this matter. Now I come to the topic, today's main events of our webinar. It is known to all that the 10th April was the birthday of our master, Dr. Samuel Hahnemann. According to the need of the hour, today we have arranged a virtual seminar on the topic COVID-19 second wave and its homeopathic intervention to celebrate it. Finally, I welcome to all my respected speakers, my delegates from national and abroad. Apart from this, the participants like doctors, medical officers, as well as the faculties of different government and non-government colleges. I'm very glad to announce here that we got Professor Subhash Singh, the Director of National Institute of Homeopathy, among with us as respected chief guest. Apart from this, Dr. Sonali Sengupta, Associate Professor of Department of Chemical Engineering, Indian Institute of Technology, Kharagpur, and also as special guest, and also Dr. Shivendu Ranjan as guest of honor is with us. I welcome all of them cordially and thanks them for giving us their valuable time in this seminar. Now I request Professor Subhash Singh to say something about the 266th Hahnemann birthday celebration, as well as on his topic, contribution of Hahnemann on evidence-based research in homeopathy. We know Professor Subhash Singh is a famous personality in the field of homeopathy in Bengal as well as India. He completed his BHMS degree from Calcutta Homeopathic Medical College and MD from Madhwa University, Aurangabad with organ of medicine. He is a popular teacher in both the UG and PG of National Institute of Homeopathy, Kolkata. The most important thing is that Professor Singh is now working as Director of National Institute of Homeopathy, Kolkata. He has also completed his PhD on the subject, History of Homeopathy and Similia. He is a popular speaker as well as author of many books of homeopathy. Welcome, Professor Singh, please.
Thank you very much. Am I audible?
Yes, sir.
Thank you, Dr. Sengupta, and all those who are here. I can see my friend, Dr. Subhash Ganguly, Dr. Sumay Ghosh. My greetings to all of them, and I congratulate you for taking time and arranging for this wonderful seminar under the heading of, under the organization HERF. And I'm sure this seminar will not be the only activity, but there will be more activities taken forward by HERF. I wish all the best to all the organizers and all who are associated with HERF. As far as my topic is concerned, I like to present a small PowerPoint. Well, is the slide? Can anybody tell me if the slide is visible?
Yes. It is visible, Dr. Shivas. It's visible.
Yes, visible, sir.
Thank you. So my topic was, I was supposed to speak on Hahnemann as a researcher who did his work on evidence-based researcher. Today, when we all have collected here to celebrate Master Hahnemann's birthday, let us start by showing our respect not only to Master, but all those who have dedicated their life and who have done wonderful work because of which we are here and because of whose dedication we are here. No other physician of his time has left as much as documentary evidence like that of Master Samuel Hahnemann. He was very meticulous and has kept all the records from the very beginning of his experiment till the end of his life. He had near about practice for 54 years, and as a physician, the records are available for 43 years of homeopathic practice. We all know that Master Hahnemann, one thing was very exceptional in his character, that was he was keeping all the notes, writing it, publishing it, putting up for the posterity so that they can understand what he has done and how he has done. And all his work, whether it is case records or the various researches that he has done, that can be found in Robert Bosch Museum, Stuttgart, Germany. Let us see some of the Hahnemann's contribution. Pre-homeopathic period, in 1786, he published Medical Legal Investigation on Arsenic Poisoning. In 1787, he published an essay on prejudice against coal fire, on the mode of improving this combustible, and on its employment in heating baker's oven. In 1788, on the influence of some kind of gas. We have to remember that all these works was before homeopathy was published. Homeopathy was announced to the world in 1796. In 88, on the test of iron and lead in wine. In 1788 again on the uncommonly powerful means for checking putrefaction. In 88 to 89, exact mode of preparing soluble mercury. In 90, translation of Cullen's Mater Medica. We all know that this was an event that ultimately led to discovery of homeopathy. In 92, he wrote Friends of Health from his experience and observation. The Friends of Health was practically the first book on community medicine or hygiene. Hahnemann was not a person to believe whatever was written in the textbook blindly, but he himself wanted to verify the fact. And this was the reason when he found in the book, Cullen's Mater Medica, while translating it, when he found for the first time, and it is mentioned that cinchona bark or Peruvian bark can work on ague or malarial fever because of its bitter taste and action on stomach. He didn't just stop there by simply translating it. But he worked on himself. He started taking the medicine just to test how far it worked. And to his surprise, he found that this is giving rise to symptoms very much similar to malarial fever. So he was not only an experimenter, but he was a person who used to record his experiments. We all know that his method of making the mercury soluble is still being used by people in chemistry. His method to find the adulteration in wine is still being used. So basically he was not only a physician, but his activity was much beyond the medical science to chemistry. And wherever he touched, wherever he started, or found anything that was not enough to satisfy him, he tested it on himself. And then he took the cinchona bark, we all know, on himself. And the result that he found, he published it in his work, Essay on a New Principle for Ascertaining the Curative Power of Drug and Examination of Some Previous Principles in 1796. Now this again, this article, if you read, it is available nowadays also, it is available in the lesser writing. If you read this article, then Hahnemann was the first person probably who, when he found a new system, he not only published to the world and let the world know how the system works, but he also announced to the world that how he has come to this conclusion. How he has come to this conclusion that similia similibus should be the foundation of a new system of medicine. Now this is the book cover, you can see, where the English book, Cullen's Metra Medica, Hahnemann was translating from English to German. So this is a cover of German book which was translated, and you can see the name of Hahnemann as translator in this cover piece. Hahnemann wrote, I made it a serious occupation for myself to prove several drugs on healthy human body. The only way to heal had not been entered upon. It was my lot to proceed along it with my own strength and by my own means of health. I proceeded. This method, the drug proving, again was a very serious evidence-based research. Because through rather than giving a medicine blindly to any disease, which was the practice at that time, Hahnemann has tried to find a system by which you can know why this medicine should be given to a particular disease condition or to a particular person. And this explanation needs to be done on evidence. And that evidence, he suggested, can be found when you give the medicine to a healthy human being, and then you will find that the symptom that it is producing is the evidence or the proof of what are the basis for selection of this medicine. So this was something, the drug proving itself was not only very unique thing, but the way it was suggested, the way this methodology was suggested by Master Hahnemann speaks much about his research-oriented mind. We all know that the first record of drug proving he published in 1805 in his famous book Fragmenta de Veribus Medicamentorum Positivis Sive Insano Corpora Humano Observatis, which was published in Latin and in 2 volumes. The first volume contains the description of the medicine, and second volume contains the repertory, and it was probably the first repertory which was published in 1805. And then we have in 1792, when he was just after translating, he was testing the similia similibus currenta and had still not announced to the world. Hahnemann, he tried to treat Clockning-Bring suffering from mental disease. Hahnemann carried out his clinical research on the mentally ill by observing and treating Prince Clockling-Berg. Now that is again an incident which is very unique, because Master Hahnemann not only treated him, but Master Hahnemann laid the foundation of treating mental patients suffering from mental diseases without harming them, without torturing them, without putting them in cages or in chains, but in a very unbrutal way. That was a system which was for the first time Master Hahnemann suggested it. He came to the conclusion, Master Hahnemann came to the conclusion that insanity is similar like any other physical disease and not due to evil spirit as was believed at that time. Hence, it can be cured with medication and proper care. We also know the Master Hahnemann in 1797, when he used veratrum album for colicodynia, and the case report is published, we can still read it, the case record in lesser writing. already previously, he wrote, already previously tried all sort of powerful so-called antispasmodics without any result, not even palliation. I am determined to give him a medicine which produces similar morbid condition in health. And then he gave the medicine veritum alone, and he has published the result. In 1801, in Königslutter, homeopathy became world famous, was accepted by whole of Europe. By this event, where the world, mainly the people of Central Europe around Germany, they were dying in hundreds and thousands because of scarlet fever. And then Master Hahnemann gave the medicine belladonna to that place from Königslutter, and when it was found it is efficacious, then it was given by other physicians to larger people. All these are there for us to see. So today, when we suffer from, when we speak today, we cannot stop ourselves without talking about COVID. We are finding so many works being done, so many researches being done, but the efficacy of them was recorded in a very scientific way in a time when the scientific orientation in the mind of the people or physician was something very rare, in so early as 1801 by Master Hahnemann, when he gave belladonna to people of Königslutter. For hydrophobia, he says how scientifically has he mentioned about this in his writing, Friends of Health, that there cannot be any prophylaxis for hydrophobia. At the same time, he also mentioned that once the bite is there, no amount of wash or cauterization can help. A physician skilled in anti-miasmatic prescribing dips deeper in the case and applies an agent that has a deeper and close relationship with the perverted life force. The results are always there. When Master Hahnemann announced to the world the theory of chronic disease, that was again something which was done on the basis of evidence researches which he has collected for 12 years. He has found that homeopathic medicine was not working on chronic diseases. And then for 12 years, he tried to find the cause, the reason, and gave the world the theory of chronic disease, which ultimately resulted in the system that we practice today, almost a perfect system which cures not only acute disease, but also successfully the chronic disease. In aphorism 80, in footnote, he has written, I have spent around 12 years in investigating the source of chronic disease based on the ascertaining proof. Homeopathy shows its superiority in treating acute condition as well as venereal disease, but failed at treating the true chronic disease. After that, he found this. He has a very inquisitive mind. This is the photograph of the table on which Hahnemann used to work in Germany when he was in Paris. See the case record book where he used to write everything in details. When at a later age he could not write it himself, then Madame Melanie or his other assistants were instructed to write every details of the patient. In spite of undertaking the best possible measure and medication by homeopathic physician, the result was disappointing in chronic disease. The chronic disease kept progressing and became worse from year to year. Basing treatment in exact accordance with the homeopathic healing art, and beginning of the treatment seems promising, the continuation less favorable, and the outcome hopeless. So just finding the simillimum was not enough when you were treating with chronic disease. And that is why he gave to the world the theory of miasm, chronic miasm. Hahnemann suspected one of the following to be the reasons for the failure of treating of chronic disease. So these are the reasons which are enlisted by Hahnemann. He thought I can be wrong in the law of similia, which may not be universally applicable, or the number of homeopathic medicine then discovered may not be enough, or there may be some defect in collecting and evaluating totality of symptom and application of law, or there may be some obstacle overlooked which could have resulted in preventing the cure. And after 12 years of hard work and ruling out the other facts, he came to the conclusion that the last but not the least is the obstacle to recovery, which Hahnemann called as major obstacle, which are deep-seated and termed as miasm. Complete cure is not only possible by eradicating these miasms, but it is possible only in homeopathy. To understand this, the family history, personal history, treatment of history of previous, and we all know any homeopathic student or a doctor, he knows how to treat a chronic disease. And then there was a potentization from one to another, and all this was result of his scientific oriented activities on mind. Evolution of the potency in 1799, first time he spoke about dilution. In 1801, first time detailed description about dilution and its preparation was stated. Then through 1816 to 1825 to 26 and ultimately to 33 when the last of his book was published and the chronic disease was published, he through time, wherever he found some problem, he tried to find some solution. And this solution he tried to found through his activities, through research, through reworking on the various formulas, to restudying his cases, and that is how he was able to overcome most of the difficulty. In this case, this is one of the places where he has evolved and finally shaped the theory of potentization. In 1833, finally, in the 5th edition, he gave the succussion and trituration. And dynamization in 1838, he says that dynamization does not mean simple dilution. Dynamization means making the medicine more dynamized, means more powerful. And 1839 to 43, Hahnemann saw that daily repetition is causing problem with weak and sensitive patients. Even after olfaction method, this problem was faced. So this led to finding a new system, that is the 50 millisimal system. So in conclusion, these are just some of the areas which I have tried to touch. But if we go through Hahnemann's life, his work, his contribution in detail, then we find that every work that Master did, every step that he has taken was not only in the direction to find the truth, but that was justified with research. That was justified with the evidence-based research. In today's time, we are talking about evidence-based research, but somewhere around more than 200 years ago, Master Hahnemann was working on it without without knowing the term evidence-based research. So Hahnemann was thus, in a true sense, a born experimenter and a researcher, full of inquisitiveness and zealous attitude, with sole aim of curing the sick. A truly dedicated life for the well-being of the suffering mankind. So, once more, thank you very much, Dr. Sengupta, for giving me this opportunity and collecting all the people that I see to hear the various aspects of today's topic, today's webinar. I congratulate you once more for taking this endeavor, and I wish that under your leadership, HERF will go a long way in enriching the homeopathic research activities. Thank you so much. Thank you.
Thank you, Professor Subha Singh, for such a nice presentation, as well as giving your valuable time here in this webinar. Professor Singh beautifully depicted the evidence-based research by your master through his presentation. The most important thing regarding the homeopathic research, presently especially, evidence-based research is a very important subject in the field of homeopathic research particularly, because the homeopathic research, the direction of the homeopathic research is the main thing, and it is our duty to fix up the direction without jeopardizing the homeopathic principles when we are going to integrate it with other center of excellence. Thank you, Professor Singh, for your nice presentation.
Dr. Sengupta, before you go further, please allow me. I'm here for some moment, then I have to leave.
Okay. Thank you. No problem. Okay, thank you.
Now, I would like to request our special guest, Dr. Shonali Sengupta, Associate Professor, the Department of Chemical Engineering, Indian Institute of Technology, Kharagpur. Now she does work research in chemical engineering, organic chemistry, chemical kinetics and upgradation of liquid fuels, and also 41 research papers and 1 patent. Their current project is modification of zeolites and its applications. Also, she is a member of scientific bodies Indian Institute of Chemical Engineers, Catalysis Society of India and American Chemical Society. Now I would like to request our special guest Dr. Shonali Sengupta to say something about this webinar organized by her, Homeopathic Education and Research Foundation. Please, ma'am.
Am I audible and visible also?
Yes, yes, ma'am.
Yes,
You are
both
audible and visible.
Both audible
Thank
and
you
visible.
very much. Okay, thank you very much. I feel honored that I am being invited and offered to talk in this graceful occasion. At the very beginning, I want to convey my best wishes to the organization Homeopathic Education and Research Foundation, which is starting its journey with the noble goals to sow the seed of interest about homeopathy among the young students as well as doctors. From my work field, all of you understand that I am not at all in the field of homeopathy. I am totally ignorant about this. But I do have some inclination towards homeopathy because my father was passed out of Calcutta Homeopathic Medical College long before, although he was not a homeopathic doctor by his profession. He was in central government service, but he loved to advise to our near and distant relatives, our neighbors who used to come to our house to his free advice and free medicine. So from my childhood, I saw that homeopathic treatment is going on in our house. And so I generate interest towards the homeopathy this way. So I do not want to talk much because I may not suit in here. I'm very happy to get associated with this organization on its very first day. I believe that this organization will progress a long way in establishing the fruitfulness of homeopathy in people's mind strongly. I wish all the very best with its all success throughout its pathway. I congratulate the persons who are associated with the foundation of this organization. Thank you very much.
Thank you, ma'am. Thank you for your motivational speech, which inspired to all of us. Thank you. Thank you very much, ma'am. Next, I would like to request our guest of honor, Dr. Shibendu Ranjan, ex-research associate from Indian Institute of Engineering, Science and Technology from Shibpur. And he also working on nanomedicine and nanotoxicology and also have one patent published in WIPO. Dr. Shibendu Ranjan has published 49 SCI indexed, and he is also the fellow of different scientific society, Indian Chemical Society, both Scientific Science Society, Indian Engineering Teachers Associations. And I would like to request our guest of honor, Dr. Shibendu Ranjan, to say something about this webinar, which is organized by Homeopathic Education and Research Foundation. Please, sir.
Thank you so much for the detailed introduction, but I'm still a learner because as a teacher, as a scientist, I'm still learning. I would like to first of all congratulate the organizers and all the homeopathic practitioners and researchers that they have the vision of integrating the homeopathy medicinal system, establishing with the advanced analytical techniques. I had an opportunity to of discussion with Dr. Milan Sengupta sir and Shobhma sir. They had a vision of proving the drug mechanism of action or integrating the homeopathic medicinal system with the advanced stage characterization techniques. Like I know that Milan sir is working on characterization techniques on LCMS and to characterize the highest potency of the homeopathic drug so that it can be established as scientific evidence. So, with such a great mind from India, I'm lucky to be interacting. And I'm sorry, I'm not a homeopathic practitioner nor a researcher, but being a biotechnologist, what I could say that these naturopathy or including all of the medicinal system which comes under Ayush, if somehow we can integrate it, we can establish evidences using the advanced characterization techniques or advanced techniques from any domain. If we can establish this fact, we can publish the fact, then the patient's compliance, reliability will increase. And obviously, homeopathy is a great way of treating the patient, because I also have experienced it personally. So I'm just wishing the foundation to grow and wishing all the best to the Milan sir, Shubhma Ghosh, and all the homeopathic researchers, scientists, and practitioners. Sorry, I could not speak much because I'm not from the homeopathy background. Yeah, I have learned about the how to give a potency to the drug, and what are the concentration, how the serial dilutions. So these things, the basics I have learned from Milan sir, but still, what I could visualize that all the great mind on a single platform and foundation like this could a great work together. So I wish all the best to the organizers and to the all the homeopathic scientists. Thank you so much. Thank you very much.
Thank you. Hello. Thank you, Dr. Shivendu Ranjan, for such a nice presentation, as well as for giving us your valuable time here in this webinar. Thank you once again, because you are sharing your research experience. Though you are not in our stream, but your interest regarding this matter is very nice. And regarding integrated research with homeopathy, your experience you are sharing with us. Thank you once again, and thank you.
Now we will start the main session of this webinar. We all know that we are in lockdown period. So we have arranged this webinar from our home. This total webinar is divided into two sessions. In the session 1, our topic will be the basics of BRYONIA ALBA. It will be discussed by the students of 3rd BHMS, West Bengal University and Health Science. And in session 2, the speakers will discuss about the COVID-19 and its homeopathic intervention. So let's start the session 1.
I would like to invite Rishita Ghosh, 3rd BHMS, West Bengal University of Health Sciences, to deliver a presentation on the topic Introduction, Guiding Symptoms, and Mental Symptoms of BRYONIA ALBA. Please, Rishita.
Thank you, Soham, for calling me. Good evening, everyone. I am Rishita Ghosh, a student of 3rd BHMS, West Bengal University and Health Science. Today, my topic is the basics of BRYONIA ALBA. BRYONIA ALBA is such a medicine which is one of the earliest proving of Master Hahnemann. It finds its place of pride in day-to-day practice of every physician. Dr. Dazen says about this that without which we might indeed shut up our shops. Next, I will give the introduction of the BRYONIA ALBA. This picture shows the entire plant of BRYONIA alba. BRYONIA alba is a climbing perennial plant. Common name is the white bryony or the wild hop. It's of plant kingdom family the Cucurbitaceae. Other species are the BRYONIA acuta, BRYONIA aspera, BRYONIA cretica, BRYONIA lapifolia, BRYONIA marmorata, BRYONIA melanocarpa, and the BRYONIA moica, etc. It grows along the hedges and the fences in the Europe. In this picture, we can see it is a BRYONIA alba root. Sorry. The mother tincture of BRYONIA alba is prepared from all the juice of the extracted from the fresh root of the plant. The time of collection is before the plant is in bloom. The active principle are the cucurbitafluorotacin glucosides and trihydroxyoctadecanoic acid. Next, I will discuss about the fear of action of the medicine. The BRYONIA alba acts upon the mucous membrane, the serous membrane, the respiratory system, especially the lungs, the liver, the rheumatic ailments, and the fibrous tissue of the body. It has a special affinity to right side of our body. Next, I will move to the guiding symptoms of BRYONIA alba. First, I will discuss about the space of the symptom. All the symptoms of the BRYONIA alba develops very slowly. They are continuous, remittent, and only occasionally intermittent. It increases into violence, but not like the first flush as seen in the aconite or in belladonna. As example, we can say, after taking cold, a person will not have the complaints in the first hours, but the day after the exposure, the patient will feel uneasy, he will sneeze, or the nasal discharge will start. Another example, we can say the rheumatism. In rheumatism, the severity gradually increases, and gradually involve one joint after another until a state of pain, a distress, or inflammation in white fibrous tissue appears. The next, that is the modality of BRYONIA alba. It's a very important characteristic symptoms of BRYONIA alba. Aggravation of all the symptoms from motion and amelioration of all the symptoms from the complete rest. Amelioration of the symptoms is also by the pressure, as the pressure reduces the motion. As example, we can say in pleurisy, the patient presses his chest tightly while to avoid the jerk and the motion. And in diarrhea also, the patient want to be quiet and want to be in rest, as least motion increases his urging for stool. Next, the great dryness of the mucous membrane. Due to the lack of the secretion of all the numerous glands embedded in the mucous membrane, there is the dryness in all the mucous membrane of our body. As example, the lips of the patients are parched and cracked, trunk will be dry and dark brown coating. As the dryness is present also in the intestine, the stool will be dry, hard, knotted, and dry cough will be also present. The next is the thirst. As this dryness of the mucous membrane also prevails in the stomach of the patient, as an evidence, there will be the presence of thirst for large quantity of cold water at a long time of intervals. Next, the stitching pain. It is another guiding symptom of BRYONIA alba. The patient will feel the needle poking in the various part of the body or the various affected part of the body. As example, the patient frequently met with in pleurisy and in pleuropneumonia, which is relieved by the rest and the pressure and by lying on the painful side. In case of Kalikarp, this symptom is seen, but the modality is just opposite the BRYONIA alba. In case of Kalikarp, the symptom will be ameliorated by lying on the painless side, just opposite to BRYONIA alba. The next two symptom is the female symptom. Number one, the vicarious menstruation, and number two is the breast symptom. In vicarious menstruation, it's a very peculiar type of symptom seen in BRYONIA alba. Nosebleed appears when the menses should appear, or blood spitting or hemoptysis also present. In the breast symptom, we can see the breast of the patients are heavy, stony hardness will be present, they will be pale but hard. The patient must support the breast with her hands to prevent least motion. Now, these are the things from which the ailments of BRYONIA alba comes from. Chagrin, mortification, anger, taking cold or getting hot in summer, or when the nights are cold after the hot days, and from the suppression of the discharges and the clean eruption also. Next, I will discuss about the mental symptoms of BRYONIA alba. The first point is the extreme state of irritability. Every word or every person that makes the BRYONIA alba patient compels him to think, to give answer or to talk irritates the patient. Dr. Kent has mentioned that any visitor is worst for the BRYONIA patient. We can see that the patient wants rest in physical plane. This same symptom is also seen in mental plane also. The mind of the patient always wants rest, so that if anyone talks to him or anyone compels him to give answer questions, then the patient is irritated. And this state of irritation aggravates all the acute complaints of the BRYONIA alba patient, like fever, like cough, etc. Next, come to the point, sluggishness of mind. As I have told that the patient always wants rest in his mind or don't want to talk, a sluggishness is developed in his mind. The patient lie down quietly in his bed. Following this sluggishness, a later state of complete stupefaction is seen in case of BRYONIA patient. Next, I will talk about the state of delirium. There is a two state of delirium of the BRYONIA alba patient. The first one is that the patient thinks that he is away from home and wants to be taken home. The homesickness is seen. While the patient is lying in his own room and in his own bed, the patient continuously says that if he is taken to his own home, better treatment will be given to him or he will be cured very quickly, as mentioned by our Dr. Kent in his book, so that the patient utters in the state of delirium. The next one is the prattle of his business. This symptom starts from the 9 p.m. mainly and aggravated at night, and in the morning this symptom decreases. As we know that the BRYONIA patient is opportunistic, looks for the opportunity, as mentioned by Dr. N.M. Chaudhuri in his book, the patient thinks about his business, so that in his delirium, these things appears. The patient prattles about his business. The next one, I will discuss about the attack from the fit of bad humor. After a fit of bad humor, BRYONIA alba patient gets attack of several diseases like neuralgia, like diarrhea, like indigestion or greediness. This same symptom is present in other three medicines also, that is the colosenthis, ignatia and staphysaceae. In these three medicine also, there is the ailments after being attacked from the fit of bad humor, but there is a difference from these three medicine. That is, after the fit of bad humor, the BRYONIA patient will have chilliness, whereas these three medicine, the colosenthis, the ignatia and the staphysaceae, will not have that chilliness. So that from this point of view, we can separate BRYONIA from these three other medicines. The next, I will discuss about the uncertain mood of BRYONIA alba. As mentioned by Dr. Kent, he wants something and he knows not what. As example, we can say that if a baby wants a fruit or a toy, when you will give it to him, he will not want it anymore. He will throw it away. Actually, the BRYONIA patient do not know what he actually wants, what can keep calm to his mind, so that he doesn't know what he wants, or when you will give the thing he wants, he will throw it away. So a uncertain mood prevails in the mental plane of the BRYONIA ALBA patient. The next thing is the desire. There is a desire for things that cannot be had, or I said previously that the things which the patient has already refused, he will have a desire for that things. Or when you offered him the things, he rejected, but later on he will have a desire for such things. These are the peculiar mental characteristics of the BRYONIA ALBA patient. Next, I will discuss the modalities of the BRYONIA ALBA symptom. The main mental symptoms of the BRYONIA ALBA is relief from the cool air. Once the patient wants the windows opened or being cool, his problem is ameliorated. Anger is aggravated from warmth also. Here are the references. I have collected my topics from the Materia Medica by Dr. N.M. Choudhury, or the book from Dr. William Borick, E.B. Nash, and Dr. Kent also. At last but not the least, I would like to say thank Dr. Milan Sengupta, MD, PhD, West Bengal University of Health Science, and faculty of our DMD Homeopathic Medical College and Hospital, for the core of my heart, for giving me such a platform to participate, to be flourished, and to gather more knowledge. And I would like to thank him also for being my guide in this webinar. Thank you.
Thank you, Rishita, for your wonderful presentation. Now I would like to welcome Shom Chattopadhyay, a fellow member of HARP, to present his seminar.
Thank you, Diptangshu, for my introduction. Good afternoon, everyone. I am Shoham Chattopadhyay, a student of 3rd BHMS, West Bengal University of Health Sciences. And today my topic is proving symptoms of BRYONIA ALBA and its clinical verification from source books. I'll be talking about some of the proving symptoms mentioned in these source books, with a special inclination towards the COVID-19 symptoms, and also along with their time of appearance. So let's start with our Materia Medica Pura, a creation of our master Dr. Christian Friedrich Samuel Hahnemann, first published in 1811. Firstly, the onset of symptoms. He wrote, even in cases where BRYONIA was indicated and had been exhibited in a proper dose, it does not always produce the desired effect in the first 24 hours. So we can assume he's talking about the insidious type of onset in case of BRYONIA patients. Next, the dryness of mucous membranes. There is a dry feeling in the back part and upper part of the throat after 48 hours. The thirst, there is a very violent thirst which especially present especially in the morning and after a meal for 16 days. But thirst after 1 hour is followed by the absence of all thirst with cold hands and feet. Next, the taste and appetite. Early in the morning, she has a taste in the mouth as of decayed teeth or putrid meat after 12 hours. So there is a distinctive offensive taste, but she has not got this taste while eating. There is also loss of appetite and canine hunger after that. Moral symptoms, which my previous speaker already discussed. There is a delirious talk about business for 1 hour and different types of delirium, apprehensiveness, and he dreads the future. Now the pain, there is all the limbs feel bruised and paralyzed in the evening. There is a distinctive stitching pain in the joints when moving or touching them. As we all know, there was never mentioned the modalities of the BRYONIA ALBA in the Materia Medica Pura, but we can assume from this sentence that he is talking about when moving or touching, it increases the stitching pain. Fever, chilly feeling in the midst of a general sudden heat after half an hour. There is the fever is also associated with chilliness, yawning, and nausea, and the fever especially increases in the forenoon. Now, coming to the COVID-19 symptoms, cold and catarrh. There is dry cough with retching seated in the upper part of the trachea. He coughs up coagulated pieces of blood after 3 hours. And also the stitching pain in the throat when coughing. So the voice becomes rough and hoarse. The chest symptoms especially present in pneumopneumonia, pleurisy, and attacks of asthma. The breathing is shorter, the expirations are more hurried, asthma after 1 hour. He's talking about the attacks of asthma, attack of pleurisy and oppression of the chest for 12 hours, pressure over the whole chest after 24 hours. Now the headache, tearing pain in the left side after 24 hours, and the headache is also associated with excessive heaviness of the head, pain in both temples, pressing from within outwards. Now coming to the Cyclopedia of Drug Pathogenesis by Dr. Richard Hughes, first published in 1895. Firstly, Dr. Arnett, his experiments. Dr. Arnett took 20 drachm of tincture of Bryonia alba on September 18, 1844 in the morning in an empty stomach. Soon after, bitter taste and eructation and along with it, dull headache. After 3 days, stool appeared to be softer than usual, so he found out there was a tendency for diarrhea. After moving about not more than usual, severe pressive pain in the forehead, especially in the supraorbital region. Next, Dr. Guberta began his proving of Bryonia alba on May 18, 1844 with 10 drachms of tincture and gradually increased the dose. He found out troublesome constipation and slight headache after 48 hours. If we remember correctly, Dr. Arnett found out there was a tendency for diarrhea and Dr. Guberta found out troublesome constipation. But after some days, there was also loud rumbling in the bowels, colicky pains, and constipation and diarrhea alternately. He found out some similar manifestations like headache and palpitation, and also exhaustion and mental depression. Now, Dr. William Huber. Dr. William Huber began his experiments with 10th decimal dilution of Bryonia alba on March 18, 1844. He first took 10th dilution and rose the dilution gradually. He found out there was great dryness of lips, back of tongue and palate, and shooting tensive pain. He found out that there was a scraping sensation at bifurcation of windpipe causing dry cough at about 10 a.m. And he also had frequent confused dreams of fighting and tardy stool in the morning, which was rather unusual for him. Now coming to the main part of my topic, the guiding symptoms of our Metria Medica by Dr. Constantine Herring, first published in 1879. Here we can find the gradation of symptoms. The grade 1 symptoms, which are indicated by red color, are reproved and re-verified. And the blue colored symptoms, they are grade 2, they are repeatedly clinically verified. Now coming to the mind, there was partial loss of consciousness, especially in cases of hydrocephalus. And as my previous speaker told, there was different types of delirium. And the patient was very much irritable and inclined to be angry. In grade 2 symptoms, he found out apprehensiveness and irritable mood, peevishness, ill humor, especially in cases of diarrhea. Now the head symptoms, there was a severe vertigo and confusion of head on slightest motion. The headache associated with fullness and heaviness. It increases when opening or moving eyes when stooping in evening. Here we can see the specific modalities of a drug present in this book. And the headache decreased from closing eyes and from external pressure. The type of the headache was gastric, rheumatic, and congestive type. In grade 2 symptoms, he found out some similar symptoms, but along with that, he found out burning on vertex near forehead and also oily, greasy, sour-smelling perspiration on head and whole body during sleep, especially towards the morning. Now coming to the gastric symptoms, mouth, appetite, desire, and aversion. As the common symptom is, there is common dryness of all the mucous membranes. So dryness of lips, tongue, mouth, etc. And the tongue is very dry and very much furred. There is also great thirst, desire for large quantities of cold water at long intervals. Desire for unusual things, acids, sweets, strong coffee, oysters. And she has almost no taste for food, which is a very common symptom in COVID-19 patients. When not eating, the mouth is bitter. Gastric symptoms consists of gastroenteritis, a gripping and pinching pain in the abdomen, diarrhea during a spell of hot weather, and as we all know, the characteristic symptom of Bryonia alba, obstinate constipation, hard, dark, dry stools as if burnt. Nose, there is epistaxis and checked menses or in places of catamenia with other menstrual derangements. Now coming to the respiratory symptoms, as always, there is shortness of breathing and asthma attacks, constant disposition to sigh and sigh deeply. It seems like the patient becomes so weak that she can scarcely speak, especially in the morning in cases of intermittent fever. There is also a suffocating feeling and asthma. The cough is dry and spasmodic, especially in night after drinking and eating. While coughing, they press with hand upon their sternum as though it needed support. Cough from tickling in the throat and pit of stomach. In evening and night, there was no expectoration, but during the day, the expectoration is yellow. Now the chest symptoms. There is a stitching pain in the chest when breathing or coughing, and it increases by coughing, breathing, and motion. Pleuropneumonia, we found out that this drug is very useful in pleuropneumonia and pleurisy and pneumonia, pleuritis, etc. There is constriction of chest. She felt the need of breathing deeply, and if she attempted to breathe deeply, there was pain in chest, as if something was distended which could not be completely distended. Now coming to the last symptom, fever, there is the predominating symptom chilliness and frequently with the heat of head. But the sweat, perspiration relieves all the symptoms. Here are my references of this presentation. And last of all, I would like to thank our guide, Dr. Milan Sengupta, for giving me this opportunity and also helping me to prepare for this virtual seminar. Thank you.
Thank you, Shoham, for such a nice presentation. Next, I would like to call Diptangshu Kushari, a student of 3rd BHMS, West Bengal University and Health Science, to present his topic on the particulars of BRYONIA ALBA.
Thank you, Rishita, for introducing me. I am Diptangshu Kushari, a student of 3rd BHMS, West Bengal University of Health Sciences. My topic is particulars of BRYONIA ALBA. In the first slide, there is adapted to person who are having a dark complexion, dark and black hair, and who are prone to bilious attacks, and who are having firm muscular fiber are more adapted for this remedy, and the side affinity is especially the right side. In the next slide, the elements form, it is formed when warm weather sets in after cold days. From cold drinks during in the hot summer, during he is overheated, or after taking cold and getting hot in summer, or draft of cold air are make the causations of this remedy. Coming to the next slide, headache. The causations of the headaches are from ironing, because during the process of ironing, the patient is exposed to the warmth, to the heat, from constipation, and all the ailments, all the causations from the ailments from slide. The location of the headache is basically frontal and occipital, and characters are, it is a type of congestive headache with bursting and splitting sensation in the head, as if everything would burst out from the head. The modality, it is aggravated from any motion in the morning after rising, from stooping, opening the eyes, and in the warm room, and ameliorated in absolute rest and pressure. The patient can use bandage, and the patient favors a dark room because it ameliorates the headache. In the pain, there is a stitching and tearing pain, already mentioned by other speakers, which is worst at night, and rheumatic complaints are better from heat. Because of this reason, the patient in the rheumatic complaints is inclined to move his limb frequently, because the movement produces heat in the joint, and it is the heat that produces the amelioration. Modality from any type of motion, and amelioration from absolute rest, pressure, and lying on the painful side. Then the respiratory symptoms. It is, all of you know, it is an important system for COVID-19 infection, in where there is excessive dryness of mucous membrane of the whole respiratory tract. In the nose, there is coryza with sooting and aching pain in the forehead. And another symptom, which is most of the time found in COVID-19 infection, which is anosmia, that is loss of smell, as mentioned by Dr. Kent, is also found in this remedy. Then the cough is hard, dry, racking with scanty or very less expectoration. There is dry and spasmodic type of cough. Often there is gagging and vomiting of the stomach contents. Then cough, there is sensation with as if the chest would fly into pieces. In case of pleuritis or pleurisy, or these symptoms are also applicable for pneumonia. These are the stitching and tearing pain in the chest, basically of the right side, and pain and soreness in the chest. When the patient coughs, he holds the chest to reduce the movement. Modalities: aggravation from any motion, inspiration after eating or drinking, any type of motion, laughing, talking, coughing, etc., and in warm, ameliorated by the same absolute rest and pressure. In case of fever, it is applicable for the second stage of inflammation, not like the first stage of inflammation like aconite and belladonna. It is both applicable for intermittent and remittent type of fever. Causations are already discussed in the elements from slide, and character is there is external coldness with dry cough and internal heat, and the pulse is full, hard, tense, and quick. Modality: from any motion, and after 9 p.m. towards the night, it is aggravated and ameliorated by complete rest and pressure. In case of gastrointestinal system, we are seeing in the second wave that these symptoms like diarrhea are present in the COVID-19 infection, especially in the second wave. So in the mouth, there is excessive dryness all over the mouth, the throat, the tongue, and the thirst. There is great thirst for large quantities of cold water at long interval of time. And the tongue is also dry with white coating, and in some cases, whitish or yellowish, dark brownish coating can be also found. Ageusia, one other symptom of COVID-19 infection, which is loss of taste, is also found in this remedy. In case of stomach, there is pressure as if a stone in the stomach, especially in the epigastric region, which is aggravated by pressure and relieved by eructation. There is nausea and faintness on the rising when the patient rises up. And in case of constipation, the causation are ongoing to see along with the general causations of this remedy. The character is the stool is very hard, dry as if burnt, with no liquid component in the stool of the patient. The rectum seems fully inactive with no inclination, and aggravation in the morning from motion in hot weather, and amelioration by absolute rest. In case of diarrhea, it is caused by during spell of hot weather, from cold drinks when overheated, and from fruits and sauerkrauts, which is a type of fruit. The characters are: the stool seems like as if dirty, watery stool with containing the undigested food eaten by the patient. It is more frequent in the morning, as mentioned by Dr. Kent, because during the morning, the patient is inclined to move more than the night. That is, the movement is aggravating the symptoms, the diarrhea in the morning. Modality: from morning, any motion, and ameliorated by absolute rest. In case of female symptoms, this was already discussed by other speakers. The breast is hot, painful, and hot, painful, and hard. The pale but hard. An important symptom which is must, the patient supports her breast during any motion. In case of menstruation, there is vicarious menstruation. It means frequent epistaxis when menses should appear. There is stitching type of pain in the ovaries on any movement or deep inspiration. There is threatened abortion from overexertion and from becoming overheated. The pain in the legs are worst from motion. Then the urinary symptoms, which is there is inflammatory condition of the kidney. The characters of urine is dark and scanty, red like brown like beer. Scanty, the urine is scanty and hot, burning in the urethra when the patient is not urinating, but it is relieved by urination. These are the references of my presentation. And last but not the least, I would like to thank my guide, Dr. Milan Sengupta, for constantly supporting me in my presentation, as well as giving me an opportunity for present my seminar. Thank you.
Thank you, Diptangshu, for your nice presentation. Next, I will call Smita Bhomik, student of 3rd BHMS, West Bengal University of Health Science, to present her part in this webinar, the relationship of BRYONIA ALBA with other medicines.
Thank you, Rishita, for introducing. Good afternoon, everyone. I am Smita Bhomik, 3rd BHMS, West Bengal University of Health and Science. Now I am going to represent my topic of today's seminar. So now comes complementary relations. In Rastas, we see in case of typhoid fever, where there is chill, dry cough, and restlessness, and constant motion seems to be only relief. Whereas BRYONIA works in typhoid fever, where motion aggravates the condition. Now comes comparative studies of BRYONIA ALBA with other remedies. There is sensation as pressure of stone in the stomach. If we compare Nux vomica, BRYONIA, and Passatella with respect to sensation of pressure in the stomach, there is more sensation of stone in the stomach in case of BRYONIA than other two. Whereas in Nux vomica, it appears after 1 to 2 hours of eating, and in case of Passatella, the sensation of pressure of stone is released from the other two. In case of thirst, in comparison with thirst with BRYONIA, Passatella, Belladonna, and Nux vomica, we get in BRYONIA there is great thirst for cold water, for large quantities of cold water at long intervals. In Passatella, there is thirstlessness with nearly all the complaints. In Belladonna, great thirst for cold water, and in case of Nux vomica, there is less thirst than BRYONIA. Now comes nausea and vomiting. If we compare BRYONIA and Nux vomica with respect to nausea and vomiting, we get in BRYONIA it increases on motion and when rising up. And in case of Nux vomica, it increases after eating and in the morning and ameliorated after vomiting. Now comes gastric derangements. In BRYONIA, it occurs due to overeating when warm weather sets in after cold days and occurs as a result of dietetic errors. In Nux vomica, it occurs more from the continued overeating, inactivity, abuse of drugs, tobacco, coffee, and highly seasoned food, etc. In case of Passatella, gastric complaints occur due to rich foods, pastries, fatty foods, and ice cream. Now, diarrhea. While comparing BRYONIA with Nux vomica and Passatella with respect to diarrhea, we can see in BRYONIA it worsens on slight movement in the morning and as an effect of overeating in the heat of summer. Whereas in Nux vomica, it worsens in the morning caused by overeating and is apt to put on dysenteric drive. Whereas in case of Passatella, the diarrhea occurs usually at night, very changeable, soon as the eat is attended with great rumblings of the bowels. Now comes constipation. If we compare the constipation of BRYONIA, Nux vomica, and Illumina, we get due to excessive dryness or lack of secretion in intestine in BRYONIA, there is inactive, no inclination, no desire, and the stool is large, hard, knotty, and dark as if burnt. Whereas we see that there is frequent unsuccessful desire and passing small quantities of feces in case of Nux vomica, and there is sensation as if not finished. It occurs due to irregular peristaltic action of the intestine. Whereas in alumina, there is inactivity of rectum, hard knotty stool, similar to BRYONIA, and when diarrhea occurs urinating, which are also similar to BRYONIA, as alumina is the chronic of BRYONIA. Next comes similarities. In belladonna, which is similar to BRYONIA in aspect of vertigo, that is, vertigo occurs when stooping or when rising after stooping. In hepatosulfuris, there is hasty speech, hasty drinking, which is similar like BRYONIA. In phosphoric acid, it is similar to BRYONIA in case of headache, that is, it usually starts from behind forward and aggravated by least motion, noise, especially music, and ameliorated by lying, similarly like BRYONIA. Now, these remedies followed by BRYONIA ALBA. If we compare Nux vomica and phosphorus, Nux vomica works in gastric complaints where there is sensation as pressure of stone after eating, which is similar to BRYONIA and arrives generally after 1 to 2 hours of eating. In case of phosphorus, it is followed by BRYONIA, is useful in case of vicarious menstruation. That is, there is indirect bleeding from the nose or lungs if menses do not appear. Next comes sulfur. It is useful in case of synovitis of knee joint, similar to BRYONIA, when both BRYONIA and Apis mellifica fails to do their work. Silicea. It works best in abscess of mammary, when BRYONIA cannot completely cure the abscess. It shows a wonderful control over the suppurative process. Here is Hahnemann. In Hahnemann, we can see there is high-grade delirium than BRYONIA, but where there is dry cough at night, which aggravates on lying down and relieved only by sitting up, just like BRYONIA ALBA. In case of pulsatilla, it is used generally in synovitis or acute inflammation of the joints, where aggravation occurs in warm room and amelioration by lying on the peaceful side, which is also similar to BRYONIA. Lastly, there is antidote. In case of pneumonia, when hepatization of lungs remain even after administration of BRYONIA ALBA and Calicarbonicum, then antimonium tartaricum is one of the best remedies. These are the references. At the end of my presentation, I would like to thank our respected teacher, Dr. Milan Sengupta, for constantly supporting and guiding me in my presentation. Thank you.
Thank you, Smita, for your presentation, and thanks to all the speakers of the session 1. Now, I will like to call Dr. Milan Sengupta, coordinator of this webinar, for concluding the session 1.
Thank you, my loving students from 3rd BHMS of West Bengal University of Health Science, for your nice presentation. Really, this presentation is very much meticulous and extensive study on basics of BRYONIA ALBA. Actually, one thing is clear from this presentation, that you have explored, you are trying your level best closely related to the COVID-19 disease with its peculiar features. The common Materia Medica as well as the source book of Materia Medica were used for this purpose to perceive the precise role of BRYONIA ALBA on the basis of its sphere of action and exact pharmacodynamics of the drugs. Thank you. Thank you once again to my beloved students of 3rd BHMS, West Bengal University of Health Science.
Thank you, sir. We have ended our session 1, and now we will start the